Hi, we're here today to talk to you about the changes to Mounjaro and the pricing and the impact that it could possibly have on our HeMed members. My name is Rachel, I'm HeMed's Chief Clinical Officer, and I'm kindly here today with Dr. Matt Noble, our Chief Medical Officer. So we're going to get into a little bit of a discussion around the impact that this could have on your journey and what you can expect. So I think it'd be really good to first understand why is this happening and what's the reason for it.
So Eli Lilly, the manufacturer of Mounjaro, has decided to increase its price across the UK. This wasn't HeMed's choice. We were informed of this at the same time as everybody else, and we are as equally frustrated and disappointed as everybody else. But what's important is we make sure that our HeMed members still have safe, affordable options to continue their weight loss journey. So Rachel, what does this mean for our individual HeMed members?
So for our individual HeMed members, it's really important that they have continuity of care and we have options to support everybody. They will have a choice to continue with Mounjaro, that will be at a higher price, or we are offering the option for our members to switch to Wegovy. This will stay at the price that everybody is already paying of the $159 for all of our doses. We have decided on a new offering, which is that first pen of £99 for the first time that they are prescribed Wegovy. As part of this, we are offering a side effect care package. We believe it's really important that everyone feels confident and supported along this journey. Whatever people choose, HeMed will always be here to continue to support them and ensure that they have the correct medication for them.
So how does that switch happen? What are the logistics of a HeMed member deciding that they wish to switch to Wegovy?
Yeah, so we will be doing this during the refill process. So you'll be asked a few additional questions when you go through your monthly refill. It will ask you about your journey when you've been on Mounjaro, thinking about the dose that you're currently on, how you tolerated the titration, any side effects that you've had. Really based on those responses, it will help guide our clinicians if the person chooses to switch to Wegovy and recommend at that point what dose they should go on, if maybe that is starting at the bottom or going on to a comparable dose. Maybe, Matt, you could talk to us a little bit today about what the clinical guidance is around that switching.
So right now there are no published studies on exactly what Wegovy dose to switch to if you're already taking Mounjaro. So what we've done is develop guidance for our clinicians that takes account of multiple consensus statements, anecdotal evidence from multiple trusted sources. So here's what we recommend. If you're currently taking Mounjaro and had no or very few side effects on your journey so far, you may be able to switch to Wegovy at a higher than normal starting dose. If, for instance, you're currently taking Mounjaro at 5 or 7.5 milligrams, you may be able to switch to a starting dose of Wegovy at 0.5 milligrams, an equivalent dose. If, for instance, you're currently taking 10 or 12.5 milligrams of Mounjaro, you may be able to switch to Wegovy at a 1 milligram dose to start with. We'll then adjust your Wegovy dose over the coming months to find the right dose for you in the usual way. However, if you did have moderate or severe side effects on Mounjaro, we would definitely recommend starting at the lower dose of Wegovy at 0.25 milligrams, just to minimise the chances of those side effects happening again. So, Rachel, tell me about the logistics. If a HeMed member does choose to switch, what will happen?
So if you do choose to switch, you'll receive your first Wegovy pen at that special switch price. That's £99. You'll also receive that free side effect care package, and that's really there to support you along that journey and ensure that you can proactively manage any side effects that you may experience. Our clinicians will really continue to review your progress and adjust your dose if that is required along the journey. Maybe, Matt, you could tell us a little bit more information around what the impact could be on my progress.
So both Wegovy and Mounjaro are GLP-1 agonist medications, so your body is already familiar with the way they work. If you're currently tolerating Mounjaro well, moving to a comparable Wegovy dose means you won't lose momentum and side effects are likely to be minimal. If you have slightly more side effects on Mounjaro, starting with a lower dose of Wegovy is probably safer, but you'll still continue your journey gradually, protecting your progress long term.
Could you tell us a little bit more information about what those side effects could be?
So the side effects of Wegovy and Mounjaro are actually very similar, but of course they are slightly different medications. It is possible that some people will experience more side effects with Wegovy compared to Mounjaro, but by tailoring that starting dose to your personal individual journey, we're going to reduce that risk. Of course, with your side effects care package, your clinical check-ins, you'll never feel on your own throughout the whole process.
We really wanted to assure you that this is not about starting over. It's about keeping your journey moving forward safely and confidently and making sure you have HeMed by your side.
Of course, if you have any questions, do reach out to our support team. We're always here to support you through your whole journey.